Hi, welcome to another episode of the Sports Medicine Moment. Again, my name is Philip Badler. I'm the manager of the Sports Medicine program. With me today is Connie Kilts. She is one of our super medical assistants in orthopedics and sports medicine. And she is going to help walk us through a journey that seems to be very commonplace. You hear it every year. More and more athletes of all ages are injuring their knee. And Connie herself has experienced an anterior cruciate ligament tear. And so I want to introduce Connie and have her tell us a little bit about what happened to her, what she was doing, what she felt, and we've also asked Connie to take us through that journey. So she's going to provide us with the experiences she's gone through from meeting with the orthopedic surgeon to going through x-rays and MRI procedures as well as surgery. So Connie, welcome and thank you very much for joining us and taking part in our video blog series for your ACL injury.
My name is Connie. I work for sports medicine and orthopedic surgery and do a lot of recreational sports, running. I lift weights quite a bit, but I decided to join a beach volleyball league. And it was our last game, of course, our last night. And I stepped wrong and I felt my knee dislocate. And thankfully, I had the privilege of playing with my athletic trainers who carried me off the court, did the Lockman's test and said, yes, it's your ACL. Was given crutches and was sent for an MRI the next day, which showed an ACL tear. The following Monday, because this happened close to the weekend, the following Monday I met with Dr. Lebolt and confirmed on MRI that the ACL was torn and I had some bone bruising. He discussed with me the options I had of a cadaver graft or using my own tendon, and we talked about the pros and cons of actually rehab. Some people rehab and live without their ACL, but I'm an older athlete, as I'm called. I'd like to stay active, and so I really needed it fixed. And so he discussed with me the patella tendon graft and all that implies, and scheduled me for surgery. I was placed in a brace and given crutches, and had surgery approximately 2.5 weeks later. And that brings us to now. I just had my third physical therapy today and making slow progress. It's painful. I was warned by several of my patients that yes, the ACL surgery is painful, but it gets a little better every day. But the Spectrum Health team has been very helpful, working me through all that and scheduling what I need.